Nothing But the Truth. Hello, I'm Raj Chengappa from India Today and your host for Nothing But the Truth. Every week, we will deal with key issues of concern and bring you perspectives and clarity as to why these matter to you and what is the clear truth that emerges. While we all have been engrossed in battling the COVID pandemic, another killer disease continues to take a heavy toll. I'm talking about tuberculosis or TB that every year kills more people in India than what COVID has done in the past 3 years. TB now accounts for close to 500,000 deaths annually in India. Yet, while we all look at COVID as a national emergency, we somehow don't regard the rising cases and deaths by TB as one of them. So in this episode of Nothing But the Truth, we will deal about the new dangers that TB poses to India and what we need to do to eradicate this modern day plague. Most of us are familiar with the term TB, but it's good to get some basics out of the way. The disease has been recorded from ancient times in India and is caused by a bacteria called Mycobacterium tuberculosis. TB spreads through the air when an infected person coughs, speaks or sneezes. Though it usually affects the lungs, it can also impact other parts of the body such as the kidney, the brain, liver, and even the spine. TB is a highly contagious disease, and people with certain types of active TB can infect as many as 5 to 15 people who come close contact with them. However, not everyone who has the TB bacteria in their system develops TB, the disease. The most common symptoms are persistent cough, blood in the sputum, unexplained weight loss, fever, and chills. If untreated, disease can progress and become deadly. It could cause severe damage to the lungs, the bones, the spinal cord, the brain, the liver, kidneys, and even the heart. Mortality rates of untreated TB is also very high. While TB has been with us for decades, why do we now have to worry about this disease? Firstly, it was earlier known as a poor man's disease. But today, TB has become the great leveler, striking not just the poor, but afflicting the middle class and the rich in large numbers as well. Secondly, India has the highest number of TB cases in the world. We have 2.5 million cases being afflicted with TB annually. And India now accounts for almost a quarter of the total of 10 million TB cases in the world. In India, almost 400,000 people die of TB every year, which is almost a third of the total of 1.4 million deaths caused by TB in the world. Thirdly, and this is the biggest worry, that India has the dubious distinction of having the highest number of cases of what is called drug-resistant tuberculosis. These are known as multi-drug resistant TB cases for short and have been growing rapidly in recent years. In India, a quarter of the total patients now have developed what is called multi-drug resistant TB. My colleague Sonali Acharji, who has written a cover story on India Today on TB recently, points out that drug-resistant TB is the main reason why the disease continues to spread and cause havoc across the country. Treatment for TB, and I'm putting it simply, is done normally in 2 phases. In the first phase, a set of 4 first-line drugs are prescribed for 2 months. Then in the second phase, the patient has to take 3 of the 4 first-line drugs for another 4 months. So it's a total of 6 months. Now, Dr. C. Padma Priyadarshini, director of the ICMR National Institute for Research in Tuberculosis in Chennai, told India Today that there are 3 main reasons why TB cases continue to increase and also develop drug resistance in India. The first is the delay in patients approaching a health facility when they have the symptoms. The main problem is the social stigma associated with TB, and this is why the disease goes somewhat undiagnosed and also people don't want to report it. This makes early and prompt diagnosis difficult. The second is irregular treatment. And the third is discontinuing of the medication before the prescribed course ends, which then leads to drug-resistant TB. Now, just remember that there are almost 6 months that firstly the patient has to take these tablets every day, which means that even if they miss 1 or 2 days, they could develop into drug-resistant cases. Now, because of the rapid rise of drug-resistant TB, this variant of the bacteria is spreading to new patients who have to be treated by newer and more powerful drugs. Now, there are relatively fewer drugs to treat drug-resistant TB, and new drugs are not widely available, and this is the problem. Also, the newer drugs are far more toxic, causing side effects including gastritis, headache, peripheral neuropathy, and depression. A detailed national TB survey done recently showed that 64% of TB symptomatic individuals did not seek health care. Another 60% of them revealed that they ignored symptoms of TB. 18% said they didn't recognize these symptoms to be those of TB, and 12% chose to self-medicate and not take the regular drugs. The survey concluded that 56% of the estimated drug-resistant patients were undiagnosed, and 64% of these cases went untreated. That is an alarming figure. To give you an idea of how dangerous TB is, let's take an example of Debshri Lokhande, a 32-year architect from Pune. In an interview with Sonali Acharjee of India Today, Debshri said that she was diagnosed with TB in 2014 and was immediately put on TB medicines. But her condition continued to worsen. Doctors found her TB resistant to 3 of the medicines in the standard 4-drug kit that I had mentioned earlier. As they struggled to find a medicine that would work, Debshri's entire left lung was destroyed within just 6 months, and the other infected as well. Desperate, the family approached a doctor at Hinduja Hospital in Mumbai. Debshri was prescribed a new set of expensive medications that were just being tested, which she received on compassionate grounds. It took 3 years of physical struggle, grappling with severe side effects such as loss of hearing and the financial burden of getting a cochlear implant for Debshri to finally recover. Now she lives an almost normal life, but she still shudders when she remembers the tough period she faced. One of them was that the expenses for patients for drug-resistant TB can be very crippling. Treatment of drug-resistant TB can take up to 2 years compared to 6 months for regular TB. And over that period, doctors say that the patient needs to take around 14,000 pills. That amounts to roughly 20 pills a day. And costs for treating drug-resistant TB can be as high as rupees 25 lakh for 2 years. In comparison, patients currently on treatment for standard or normal TB need to spend around rupees 7,500 in the public sector, and in the private sector it's a little more expensive, it's around 20,000 rupees. That is why it is important that we contain the number of drug-resistant TB patients in India. So what is the country doing about the new dangers posed by TB? India's National Tuberculosis Elimination Program has been running for over 50 years now. Prime Minister Narendra Modi had pressed the accelerator pedal, so to speak, on eradicating TB altogether in the country. In Varanasi in March this year, that's just 3 months ago, the Prime Minister reiterated India's commitment to eliminate TB by 2025. That's 2 years from now. This year, or this 2025 figure, was 5 years ahead of the target set by the United Nations for the global eradication of TB worldwide. The Prime Minister also launched a TB Mukt Panchayat initiative to bring efforts to eliminate the disease down to the last village. As part of this initiative, the support of 250,000 Gram Panchayats will be enlisted to create awareness about TB and also monitor service delivery or healthcare delivery for TB. Now, last year, President Draupadi Murmu launched the Pradhan Mantri TB Mukt Bharat Abhiyan, which allows ministers, celebrities, businessmen, corporates and NGOs to adopt TB patients and become Nikshay Mitras. What they do is they help mobilize financial resources for them, and currently the government says nearly 75,000 people and organizations are part of the scheme, and over 1 million patients have been adopted in this method. The government is also enlisting what they call TB Vijetas, people who have conquered the disease, to educate people and give emotional support to patients. Unlike regular TB, it can be challenging to map the full extent of drug-resistant TB because it requires specialized testing to detect. early diagnosis is a critical frontier that the government is also focusing on. Unlike regular TB, it can be challenging to map the full extent of drug-resistant TB because it requires specialized tests to detect. These tests are often expensive and not widely available. Meanwhile, new testing technology called TrueNAT, N-A-T, and CB-NAT, which is N-A-T-T, are game changers for the rapid and accurate diagnosis of TB. I'm not going to expand on these abbreviations for those diagnostic facilities, but the expansion of these diagnostic facilities by the government has been enormous. The government has been pumping money into hiring people and building infrastructure for it, and the number of TrueNAT and CB-NAT facilities in the country has gone up from 40 in 2014 to over 5,000 now. Apart from that, all the 34 states and union territories in the country conducted door-to-door campaigns under which 223 million people were screened and 73,772 additional TB patients were identified, and this was in 2021. Various state governments have now started building private partnerships to improve diagnosis. Haryana is showing the way with Gurugram's Medanta Hospital working with the state in the mission to end TB by 2025. Medanta chairman, Dr. Naresh Trehan, told India Today, and I quote him, "We realized conventional X-rays are not reliable for diagnosis and rural areas in the state needed digital X-ray technologies. So we created mobile vans equipped with digital X-rays and other technologies for quick diagnosis of drug-resistant TB." I close quotes, and we believe that such partnerships will be key to helping rid India of the scourge. In an encouraging observation, the India TB reporter noted that of the people diagnosed with TB in 2021, almost 95.5% were put on treatment. Since affordability is a bottleneck, the government has launched several schemes to help patients. For instance, the government provides financial assistance of Rs 500 per patient under the Nikshay Poshan Yojana and free medicines through the government hospitals. Around 7 million TB patients have got assistance worth around 2,100 crores since 2018 under this scheme. The Indian government remains determined to eliminate all forms of TB by 2025 and believes it is well on its way to achieving that target. According to the Union Health Ministry, Kerala and Karnataka reduced cases by nearly 40% between 2015 and 2021. And in fact, Lakshadweep and Budgam district in Jammu and Kashmir were declared TB-free in 2021, and overall Jammu and Kashmir has reduced cases by 20%. India's recent efforts and initiatives are being lauded by the Global Alliance for TB. But experts remain skeptical of its ambition to eradicate TB entirely in India in the next 2 years. The goal of 2025 is strictly aspirational. But what it does do is that it accelerates the momentum to eliminate a disease that has devastated India in recent decades. And that is good news. For more details on the resurgence of TB in India and how it could be eradicated, do read the cover story in India Today written by my colleague Sonali Acharji on the subject. Thank you for listening to this episode of Nothing But the Truth. I look forward to having you with me the next week. Nothing but the truth.